Hello there. I'm Dr. Lipi Roy, and welcome to my show, Health, Humor, and Harmony. On today's Women's Health Wednesday, I'll be discussing May as National Osteoporosis Month, where the aim is to promote good bone health through prevention, detection, and treatment of osteoporosis. Did you know that according to the National Osteoporosis Foundation, about half of all women and a quarter of all men over age 50 will break a bone in their lifetime? And did you know that two-time Oscar-winning actress Sally Field has been a spokesperson for osteoporosis awareness after being diagnosed with the disease in 2005? So, what is osteoporosis? It's a disease that weakens bones and increases the risk of sudden fractures. The word osteoporosis means porous bones. Viewed under a microscope, diseased bone resembles a honeycomb with large holes and spaces. Osteoporotic bones have lost density or mass and contain abnormal tissue structure. Who gets osteoporosis? According to the Cleveland Clinic, about 200 million people across the globe have osteoporosis. The Department of Health and Human Services Office of Women's Health reports that osteoporosis affects about 10 million people in the United States, among whom 80% are women. Women are 4 times more likely to develop the disease than men. After age 50, 1 in 2 women and 1 in 4 men will have an osteoporotic related fracture in their lifetime. Another 30% will have low bone density, known as osteopenia, which increases the risk of developing osteoporosis. It's most common in white and Asian women, although Black women are less likely to get screened and have worse outcomes after a hip fracture, mostly due to health disparities. Why the higher risk in women? Women usually have smaller, thinner, and less dense bones than men. Women often live longer than men. Women also undergo rapid bone loss in the first 10 years after entering menopause because of a drop in estrogen, which is a hormone that protects bone density. I cannot overestimate the harms of osteoporosis in females. A woman's risk of breaking her hip is equal to her combined risk of breast, ovarian, and uterine or endometrial cancers. So, what are the symptoms of osteoporosis? At times, there are no symptoms. That's why, like high blood pressure, osteoporosis is sometimes called a silent disease. However, when symptoms do occur, they can include bone fractures, loss of height, getting like an inch or more shorter, a change in posture, such as bending forward, low back pain, and shortness of breath, because the ribs can't fully expand during exhalation from the curvature of the spine. So, how is osteoporosis diagnosed? A DEXA scan is an X-ray that uses low levels of radiation to measure bone mineral density at different bone sites that are prone to fracture, such as the spine, hip, and wrist. All women over age 65 should get a DEXA scan, or earlier if they have risk factors. Men over 70 should get a DEXA scan, or earlier, again, if they have risk factors. So, how is osteoporosis treated? The following 5 interventions can slow or stop bone loss and prevent fractures. First is proper nutrition. Lots of fruits and vegetables, as well as calcium, vitamin D, and protein can decrease your risk of osteoporosis. 2 is exercise. It builds muscle mass and strength and improves coordination and balance, all of which can reduce your risk of falling. And third, Lifestyle changes. Avoid tobacco, drink in moderation, and get regular medical checkups. Fourth, fall prevention to prevent fractures. Examples would include wearing shoes with good rubber soles, using handrails, or a walker or cane if needed. And then five, medications. FDA-approved medicines to treat osteoporosis include bisphosphonates like ibandronate or Boniva and alendronate or Fosamax, calcitonin, estrogen and hormone therapy, and parathyroid hormone analog like teriparatide or Forteo, which increases bone mass in men and in postmenopausal women who are at high risk for getting fractures. So how can you get involved? You can sign up for a clinical trial. You can learn more about the risk factors, screening, diagnostic tests, and treatment options for osteoporosis. Then share this important information with your family and community. Remember, knowledge is power. You can also learn about the racial disparities in osteoporosis. Lastly, you can donate to or volunteer with any number of organizations, including the Bone Health and Osteoporosis Foundation, the American Society of Bone and Mineral Research, the National Council on Aging, the American College of Rheumatology, the National Institute on Aging, the American Orthopedic Association, and the Global Healthy Living Foundation, as well as many more amazing organizations. Well, that's it for today, folks. And here's your hump day joke of the day, bone theme. Why are rib cages bad at lying? You can see right through them. Thank you for tuning in. Be sure to join my show this Friday, 3 p.m. Eastern, when I'll be discussing hypertension and fitness. And be sure to subscribe to my YouTube show and follow me on Instagram at Health Humor Harmony Dr. Roy. Be well. I'll see you soon.